Hi, my name is Fatima Tuz Zahra. I'm a hematology and oncology fellow at the Moffitt Cancer Center. Very excited to be here at ASH, and I'm presenting our clinical project, real-world survival outcomes following allogeneic hematopoietic stem cell transplantation in peripheral T-cell lymphomas. This project was a collaboration between our institution and University of Miami. So, as we know that peripheral T-cell lymphomas are a heterogeneous disease group. Several histologies are considered high risk, and we do allogeneic stem cell transplantation as first line in those specific histologies, specifically including hepatosplenic subtype or adult T-cell leukemia/lymphoma or NK T-cell lymphoma, whereas in other histologies such as PTCL not otherwise specified or ATLL and ALCL, allogeneic stem cell transplantation is often utilized in the relapse and refractory setting. So we combine all these cases, and the study aimed to look at the real-world outcomes with the allotransplant in overall T-cell population, and we wanted to see what are really the predictors of good or worse outcomes from the transplant itself. So here we have some baseline characteristics of these patients. The most common histology in this whole cohort of 99 patients was PTCL not otherwise specified. Second most common was angioimmunoblastic T-cell lymphoma, and then we had some ALCL patients, very few, but ATLL patients. We did have some natural killer T-cell lymphoma patients, 9 of them, and then we had some very rare histologies that we combined together for our analysis, including EATL, primary cutaneous gamma delta T-cell, and hepatosplenic T-cell lymphoma. Obviously, these are the patients who did receive transplant for their disease. A lot of them had advanced stage disease, stage 4 disease, and had high IPI risk group. So when we looked at the survival outcomes for the overall patients, we found that for the patients who did survive this whole transplantation process, and this included a total of 51 patients, the median follow-up was 60 months in these patients, and the median overall survival was about 8 years. The median progression-free survival was about 2.5 years in these patients. Then we specifically look at transplant-related outcomes, and we saw that the day 100 acute graft versus host disease was seen in about 44% of the patients. And severe chronic graft versus host disease was only seen in about a quarter of patients at year 1 mark. Then we also looked at certain clinical variables and how they affected the survival outcomes. When we performed our univariate analysis, we saw that if the patients were not in complete remission prior to transplant, this was associated with higher mortality. Also, if the patient's performance status was more than 1 on the ECOG scale, they did have a higher hazards ratio of mortality. We then performed multivariate analysis to truly analyze that which of these predictors most significantly impact the transplant-related survival of the patients. We found that if patients had a diagnosis of ATLL compared to if they had PTCL not otherwise specified, they had much higher chance of having a relapse after transplantation. Also, we found that if the patient had poor performance status, meaning ECOG of more than 1, they did have a higher chance of having non-relapse related mortality. Also, if patients were in just partial response or worse response instead of being in complete response prior to transplant, they had a very high chance of going into relapse after transplant. So overall, I would summarize by saying that this real-world cohort of data shows that response prior to allogeneic stem cell transplantation is important, because being in a complete response yields better outcomes post-transplant than being in partial response or being in a worse response than that. Also, we found that having a limited performance status, meaning that having an ECOG of 1 or above, correlates with higher chance of non-relapse mortality. But again, we see that our survival outcomes are good for patients who do survive, with a median overall survival of up to 8 years for surviving patients, which tells us that allogeneic stem cell transplantation primarily remains still a potentially curative therapy for a significant number of these patients. But however, as we just alluded to, for specifically the ATLL, the adult T-cell leukemia lymphoma subtype, there are significant unmet needs, because these patients continue to have worse survival compared to other T-cell histologies. So the hope with this project is putting some real-world data out, and hopefully we'll be expanding this project with some other institution to have more number of patients and publish the whole manuscript to look at what are truly the predictors or what are specific histologies that derive the most benefit from allogeneic stem cell transplantation, and which are our rare subtypes in whom still there is significant unmet need of treatments that can improve survival of the patients, because allogeneic stem cell transplantation perhaps is not yielding as great of an outcomes in those patients.